Hello and welcome back to Patient Awareness. My name is Hannes. In our previous video, we introduced discovering HANS to you. The most important message from the last video is cancer can be curable, especially if detected and treated early. In today's video, I will explain treatments and breast reconstruction options to you. We will always try to keep the videos short and simple. This one will be a little bit longer because it's a broad topic. To us, it's important that you gain an insight, and in case you or your loved ones suffer from breast cancer, you can find the right surgery or treatment option with your doctor. Being diagnosed with breast cancer is a big shock at first. Fear overwhelms, insecurity rises, though you are not alone in this situation. As we have learned, breast cancer is one of the most common cancers worldwide among women. It is very important to inform yourself about the right treatment. Today we will explain some of the treatment methods to you. After the diagnosis, often a surgery is necessary. Often these can be done without removing the whole breast. In some cases, however, it is unavoidable to remove the breast completely. So you get cancer. What now? The goal of cancer treatment is to cure you from the cancer and to allow you to live a normal lifespan, and the quality of life should be given. So what options of treatments do I have? It can be surgery, it can be radiation, medications, or other therapies that shrink a cancer, cure it, or at least stop the progression of the cancer. Many treatments are out there. Sometimes you may get one treatment or even a combination of different treatments. When talking about treatment, it can be divided into three groups: the primary treatment, the adjuvantive treatment, and the palliative treatment. The primary treatment, the goal of it is to completely remove the cancer from the body or to kill the cancer cells. The most common primary cancer treatment is surgery. We will list different kinds of surgery options on our homepage and explain a mastectomy, breast surgery in a following video. But also radiation or chemotherapy can be a primary therapy. It is being done if the cancer is particularly sensitive. The adjuvantive treatment. This treatment is done after a primary treatment to kill off any cancer cells that might remain. This is done to decrease the chance that the cancer might come back. Common adjuvantive treatments here are chemotherapy, radiation, or hormone therapy. These treatments are sometimes also done before a surgery in order to make the primary treatment more effective or even easier. Then this is called a neoadjuvantive therapy. And third, the palliative treatment. Palliative treatments are there to relieve you from the side effects of the treatment or from the side effects caused by the cancer. Surgery, radiation, hormone therapy, or chemotherapy can all also be a palliative treatment. Painkillers or other medications can be mixed with the therapy options to help against the pain or other symptoms. The goal of palliative treatment is to give the patient the best quality of life until death. Now let's give you a brief overview of the different treatments. Surgery. The goal of surgery is the removal of cancer or as much of it as possible. The chemotherapy. Here, drugs are used to kill off cancer cells. In radiation therapy, high-powered beams or rays are used, like X-rays or protons, to kill off the cancer cells. This can be done by machines from outside of the body, which is the external beam radiation, or it is placed inside the body, which is called the brachytherapy. Bone marrow placement. Bone marrow placement is also known as your own bone marrow stem cells, which are used or can also come from a donor. It is the material inside of your bones that makes the blood cells. With a bone marrow transplant, a doctor is able to do a higher doses of chemotherapy treatment on you and your cancer. And immune therapy. In immune therapy, your own body's immune system is used to fight cancer. Sometimes cancer grows undetected by your immune system, and the immune therapy helps to detect the tumor and fight against it. And then hormone therapy. This is basically when breast cancer or prostate cancer use your own body hormones to grow. By removing these hormones from the body or by blocking the effects of your own body hormones, it can cause the cancer cells to stop growing. And then we have targeted drug therapy. Here the drug treatment is targeted on specific abnormalities of the cancer cells that allow them to grow or survive. And then we have cryoablation. Cryo means involving or producing cold, especially extreme cold. So there's a very thin needle that is inserted into your body to the cancerous tumor and is frozen by a gas pumped through the needle. So your tissue freezes and thaws again. This process is repeated a couple of times during the same treatment until the cancer cells are killed off. Radiofrequency ablation. This is the opposite of the cryoablation. Here electrical energy is used to heat the cancer cells, which results into cancer cells to die. A thin needle is guided by a doctor into the cancer tissue, and high frequency energy goes through the needle into the tissue. Clinical trials. Here, new ways of treating cancers are investigated in clinical trials. There are hundreds, even thousands, tested and under trial right now. So what do you do specifically with breast cancer? Your treatment options are either a breast conserving therapy or a mastectomy. Let us explain this a little further. When treating breast cancer, the surgical removal of the tumor is an essential part of the therapy. Often this happens after the diagnosis. In the 80s, radical surgery techniques dominated, meaning the removal of the breast. Nowadays, the breast can be preserved and conserved in 2 out of 3 cases. Before breast conserving surgery, chemotherapy, anti-hormone or antibody therapy is sometimes given to you to reduce the size of the tumor or to destroy it completely. Studies show that removing the tumor offers the same chances of recovery as removing the entire breast, called mastectomy. But more about the breast conserving therapy and mastectomy in our following video. And again, we want to highlight the importance of early detection. The earlier you can find the tumor, the higher your chances of survival. Cancer can be curable, especially if detected and treated early. You will find more educational videos and information on our homepage. If you want to learn more about breast cancer, please look into our series of videos. Thank you very much for watching, and I hope to see you soon.